Davi-tech-media. Subscribe to Davi-tech-media. Davi-tech-media. Subscribe to Davi-tech-media.
Hey friends, welcome to Luchimbi David, your host and producer at Davi-tech-media. This is your #1 news channel where news, trending videos, political news, gospel music as well as entertainment is concerned. There you go. Today I've got an update to give out to the public out there. Watch this.
Volunteers, they retired, they graduated from their training and they're looking for work and they can't find work, and so they've agreed to work with us on voluntary basis, hoping that we can absorb them one time or another. All that shows to be that there's some positivity in terms of numbers, but obviously a new challenge has come, meaning we need to employ these people, but we don't have space, we don't have resources. So the demand for disease is high. Even the ministry itself has grown. More facilities have been constructed, and I know that most health centers need more staff. And the staff are there, but we have not employed them. It means that we need to look at the organization structure to increase the numbers. It means that we need to find resources to pay these people. That is the new challenge. And I think it is a challenge that has been identified. It is a challenge that even in the presidential speech the president has addressed, and the answer has been that we need to up or to increase resources towards the health sector. But I note that it's not just the recruitment that is a challenge when we are looking at the issue of human resource. I think there is also the issue relating to those that are already with us, having worked for more than 10 years, having improved on their professionalism. No. They may be having improved on their professional qualification. One would expect that either now they should be receiving a better salary, isn't it? Or their title should change, but they've remained the same. Now that is, for me, a very nice issue, because that borders on an individual and it can demotivate an individual. So we don't want to carry a labor force of demotivated health workers. We want workers that are motivated. And so some of these issues are issues that we must address in this coming budget, this 2022 budget, so that at least we should be seen that we are responding to a challenge that has arisen within the healthy, within the healthy, what is the word now? Yeah, health sector, but something to do with human resource, in the human resource sector of health. That's what I wanted to say. So it is a matter that those concerned here must begin to look at and see how best to address it. But in addressing any issue you want to address, you must look for the money. So don't just address an issue minus money. So we have to look at our allocation that will come, then we have to look at what will be our priorities. Whilst our priority will be to ensure that everything goes to the person at the community level, but everything, including human resource, including stocks of drugs and equipment, and other issues, all those issues must be addressed. So we have to do a balancing on how we allocate the resources. Of course, when you are 17 of you, it's not an easy exercise. It's not an easy exercise, but we'll be guided by the manifesto. We'll also be guided by the plans that we're going, the internal plans that we're going to have, so that everything is taken into account. So the issue of workers and their motivation as it relates to their qualifications, improvements, promotions, and so on and so forth. And then of course there are those issues which are very simple, because they have what you call housekeeping issues. This one has been transferred, he was at the province, has been transferred to the district. This one was doing this, now he has been transferred there because he doesn't like your glasses. This one, those are small matters that I think we must be above board. The president always tells us, you don't have to like me. What is important is we have a common agenda to save the people, isn't it? So we don't have to be best friends. No, we just have to work together, isn't it? So we should not get our personal issues into work. Because you don't like how he looks or you don't like how he speaks, then because of that you must frustrate him. Because when you frustrate each other, then you know that the outcome will not be okay. Will be low in terms of what we expect. I think the last one, in terms of the presentations, was from the promotional side and issues that can help us do prevention. Like I said earlier, it would be better for us as a ministry to do a lot of work in the prevention side so that people don't even have to go to the hospital. Some of you here have never been to hospital, you have never been sick in the last 2 years. That's what we need everybody to be. And the reason is simple, because you understand you have some education on how to keep yourself healthy. You also have an income, you're able to eat well. You know, for others, you even have education to understand that physical, exercise is important to your health. So those issues are the issues we should also take to the community. Get the community to understand about physical health, get them to understand about basic cleanliness, hygiene, and so on and so forth. But like I said, issues of hygiene should start with ourselves as a ministry. If you can go into a hospital, no soap, no simple toilet paper, it looks like we are going to get back to the basics. Somebody was laughing. Imagine, the minister is talking about tissue. But I was just trying to show you how basic we have become. Because that's where we are. We have no tissues, we have no soap in our hospitals. In some cases, there's even no water. So if there's no water, what health care are we giving? Shouldn't we start with water? We should start with water, isn't it? So we need to start with the basics. Water must be there, soap must be there, a tissue must be there, a bucket for sanitary pads must be there. Basic as it is. The next basic thing, it is how we present ourselves. You can't have a nurse with nails like this and you say she's going to give health care. Nurses, the reason why we're giving nurses uniforms is because how you dress impacts on how you work. If you're wearing a white dress and you've got shoes like this, nails like this, eyelashes like this, and you're a nurse, you want to save a patient who is dying. Guys, sure, are we serious? Those are basic things, but they're real. Those are basic things that are real. I think some professions, professional jobs, let's have simple rules and regulations. If you want to be a nurse, nurses, you wear flat shoes, isn't it? That's what you used to wear, isn't it? So why should we change to high-heel shoes in the hospital, in a ward? And you are the only one there, or you are few of you, and you've got so many patients. We need to get back to the basics. And those are the basics. We must have water. The clinic must be clean. The linen must be clean. The curtains must be clean. The room must be clean. The toilet must have water. The toilets must have a tissue. Simple. We are done. Secondly, the person who is in there, who is called a nurse or whoever is called, must be dressed properly. And dressing properly means the basic things should be in a ward looking after children or looking after mothers or looking after patients with nails long like this. Because even at home, when I have long nails, I can't hold it, I can't even cook properly. It simply means I'm not the type of woman who is interested to cook for my husband for that man. Because my nails are too long. That's the implication. So I think that we need to get back to the basics, even as we talk about cancer and all those big stories, or which is of our core business. Maybe for now, I'll stop so that we continue with the presentation. I know that I could have touched certain things which are not in the pre-presentation, but I thought maybe I just give a bit of information to the press. The press now can leave us.
Thank you very much for tuning in at Davi-tech-media. Remember, Davi-tech-media is the media that shares news, trending videos, political news, gospel music, as well as entertainment. Please don't forget to click that subscription button and that notification bell to be the very first person to receive the video that will be produced and posted by Davi-tech-media. Davi-tech-media, updating you.